Now, I would like to introduce Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation. Lydia?
Thank you, Janice. Good morning, and thank you to everyone for joining us today for my Transplant Experience webinar. Before we begin, we would like to recognise the Indigenous land that we are on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honouring the original occupants of the place. They also help Canadians to recognise and respect Indigenous peoples' inherent kinship beliefs when it comes to the land. I encourage everyone to take a moment to reflect on that and acknowledge it. I live and work in Toronto, which is situated on the traditional lands of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with First Nations, Métis, and Inuit people across the country. The Kidney Foundation would like to thank our sponsors for this 2022 webinar series: GSK Canada, Horizon, Janssen, Otsuka, Paladin, and Takeda. Their ongoing support allows us to bring many together, like today, to have broader, bolder, and braver conversations. Today's goal is to provide you with knowledge to help you understand you are not alone and ultimately help you feel more empowered. We're really excited to be able to discuss this 3-year study that focused on the lived experience of people on a transplant journey. Over 1,000 patients, living donors, and caregivers generously shared their experiences with us. And in this interactive webinar, we'll share what we learned. Patient partners will share their journeys and contributions to the project, and we'll dive into why and how to participate in research studies. The information shared in today's webinar is current as of today, December 14, 2022. The material shared in this presentation is not intended to be medical advice. You should speak to your doctor and care team about your own individual situation. This information is intended for a Canadian audience. Now we are thrilled to introduce our speakers for today. Thank you so much for making the time to share this important information. Firstly, I'm introducing Carrie Thibodeau, who is the Manager of Health Policy and Government Relations at the Kidney Foundation of Canada, and has had the privilege of serving as Project Manager for the Improving Engagement and Empowering Patients on Their Transplant Journey study. Her educational background is in applied health sciences and communications, and the focus of her professional career has been on kidney health. Carrie also has a close family connection to the kidney and transplant communities, and this project has been an opportunity to be part of a team responsible for ensuring that patients' lived experiences are central to the decisions being made about how to best manage organ donation and transplantation in Canada. Next is Christy Caldwell, who is the Senior Advisor for Transplant Research Advocacy at the Transplant Research Foundation of BC. Having undergone a heart transplant as a teenager due to congenital heart disease, Christy is acutely aware of the role research plays in improving outcomes and enhancing quality of life. She believes patient and family partners have an important role in shaping and informing research to ensure it is meaningful and accountable to all stakeholders. She also serves as the co-chair for the Patient Advocate Advisory Committee of the Organ Donation and Transplantation Collaborative, a Health Canada initiative that brings together key stakeholders in Canada's ODT system. And finally, Dr. Sandra Davids, who is Dean and Faculty of Nursing and Deputy Provost at the University of Calgary. Her 28-year career in nursing and healthcare, she has served in a wide range of academic and practice environments that span private, for-profit, public, not-for-profit, and both large and small public universities. She is well known in each position she has been for her entrepreneurial thought and creative innovation. She's a co-editor and author of the award-winning book, Leadership for Evidence-Based Innovation in Nursing and Health Professions, now in its 2nd edition. Her research focuses on health systems transformation, living well with chronic disease and aging. She is a fellow in both the Canadian and American Academies of Nursing. Dr. Davidson obtained her PhD in Leadership Studies from Gonza University in 2011 She earned her Master of Science in Nursing at the same institution in 2001 and received her Bachelor of Nursing from the University of Lethbridge in 1996. I'll now hand over to our presenters.
Thanks so much, Lydia. And hi, everyone. Welcome. Really grateful to have you with us today. I know we're just going to take a few minutes to start this by really sort of laying the groundwork by sharing our own personal journeys with transplant and help you understand more why this work is so important to us. So for me, as Lydia mentioned, I am a heart transplant recipient, but my journey with the healthcare system began long before that. So I was born with congenital heart disease, and I underwent various open heart surgeries and procedures in my childhood and my adolescence. And then finally, when I was 17, I was told by my surgeon at the time that I required a transplant if I wanted to live. And of course, I did. It was hard news to hear, but not something that I was surprised of because I'd known throughout my entire life that this was likely going to be the ultimate road for me. But what was surprising was learning that my transplant could not be performed in my home province of BC because at the time we did not have a pediatric heart transplant program. And so that meant that my mom and I were going to have to pack up and move to Toronto, where I would be waitlisted. And that meant really leaving the only home I had ever known for a very strange and unfamiliar city where we knew no one, where we had no support. So that was very difficult. And I very much recall, when I had to say goodbye to all my family and friends, I honestly I didn't know if I was ever going to be seeing them again. And that was hard. And arriving in Toronto and undergoing all the various assessment for being listed, once that was completed and I was listed, the wait began. And I think unless you've been there, you can't possibly understand what it's like to wait for a donor organ. I was watching myself fade a little more every single day. Essentially, I was dying more every day. And that was hard. My mom and I both knew I could pass in my sleep, suffer, a fatal arrhythmia, one that my heart would not be able to withstand. And it was very difficult. But I was fortunate in that just after 3.5 months of waiting, I received a call that they thought they had a donor heart for me. And in that moment, of course, I was overjoyed, but I was also very overwhelmed because I immediately thought of my donor and their family. And I had to tuck that away because that was just too much. It was too much to process. And I really needed to focus on the task at hand. And that was surviving. And that first year post transplant was probably the most difficult time of my entire life, even to this day. I suffered a cardiac arrest a few days post transplant. I endured numerous bouts of rejection and infection. It was quite a harrowing time. But in the same breath, I had never felt so well in a very odd way because for the first time ever, I knew what it was like to have a normal heartbeat. I finally had the air it took to laugh, to talk, to go for a walk, things that I had never done before. And this was really, it was remarkable to me. It was a whole new world had opened up. And of course, as time progressed, my health, my physical health steadily improved. But it was that emotional and that psychological components that didn't recover so quickly. It was really hard knowing that I was alive because of the stranger's heart that beat in my chest. And I know my mom, she struggled too. It was hard. She'd often tell me that she couldn't escape it. She could still hear the sights and smell the smells and hear all the sounds, particularly of the ICU of that hospital. I think we were both traumatized. But of course, at that time, there wasn't a lot of recognition of the PTSD that accompanies the transplant journey, and there wasn't a lot of supports available. So we did what we did best, and that was put one foot in front of the other, and we carried on. And this August actually marks 22 years of life for me with the same heart that for those of you in the transplant world, I'm sure you can appreciate that long with the same donor organ. It's pretty huge. And in those 22 years, I've been able to accomplish things that I never thought would be possible. I graduated, I went to, I received my degree, I fell in love, I got married, and I am proudly a crazy dog lady now who takes and fosters a little senior foster and palliative rescue dogs. I have 4 with me right now, so hopefully they behave, but my life has been very rewarding, one that I am so incredibly grateful for. But that being said, there's been a lot of challenges along the way. It's not an easy journey, but just most recently, I was able to celebrate my 40th birthday, which for me was a huge milestone because for the longest time, I just wanted to make it to 27 because that meant 10 years post-transplant. So when that happened, I set a new goal to make it to 40. And I think quite honestly, I never thought I'd live to see that. And so now I'm kind of reformulating that plan and I'm like, hey, what's my next goal going to be? And when I blew up my candles, my husband and I, we said, here's to another 40. And we both kind of joked and laughed at each other because we thought, okay, let's be a little more, let's be ambitious, but realistic here. So I'm setting it at 50. And that's just the realities of transplant life. And, that is why projects like this is so important because I know research for me, it really is the hope, my hope for the future, my hope for my current quality of life, as well as the prognosis. And that's why I'm so invested in these types of projects. And I really want to ensure that patients like me have their voice heard. And that's why I'm really excited to be with you today to share this important work because this is our lives. We don't get a break. We don't get to take a holiday or escape it. This is something we live with day in and day out. So I look forward to sharing with you more about this research project that we have been on for the last 3 years. But with that, I will pause and I will hand it over to my friend, Sandra. Thank you.
Thanks, Christy. And it's just, listening to you talk, there's so many, I guess, aspects of what you share that you're right. You can't appreciate it unless you've lived a transplant journey in some way, shape, or form. And so everything you were saying is just so meaningful and so powerful, and again, why this work is so important. So I know my bio was very kind of academic, and when they asked me to send my bio in, I sent the one I always send for work. But there's a story behind that, and my family has been affected by kidney disease through many generations, through actually what we now understand is Alport syndrome. My husband, particularly, you see him in the middle picture there, that's Jim. He, at a very young age, when he was in first year university, suddenly found out his kidneys were failing and he had to go on dialysis in his early 20s, and was on dialysis for several years. And then his father got worked up to be a living related donor, a near perfect match, which was wonderful. And so they had a transplant in 1994. I met him about 2 weeks after he was out of the hospital from his transplant with a new lease on life. And about 6 months later, we were engaged to be married. So I've walked that journey pretty much all the way with him and his family. His kidney, as Christy had said, 23 years that his father's donated kidney meant that we had an absolutely wonderful, as close to normal as possible life. We traveled the world, but again, there was always the checkups and wondering, how the creatinine is going to be this time, and the chance for rejection, and all of those things were always in the back of our minds. And finally, in 2017, it became clear that the first kidney was not going to last. And actually, we had to come to terms with the fact that he would need to go back on hemodialysis. And he was on hemodialysis for 13 months in 2017 and 2018. And so what you see on the left-hand side of the screen is actually his last hemodialysis before his new kidney arrived in April of 2018. There was a long wait list. And so, and similar to what you said, Christy, I saw the man that I love slowly becoming weaker, and slowly receding. And you can see the picture in the middle there. That was a week after the day that he was released from the hospital after his second transplant in 2018. You can see he's quite thin. And I'm happy to say he's back looking a lot more robust and less pale these days. But that was a really wonderful day to see that turn of the new kidney. I ended up actually volunteering to do a living donor. So I am a living donor, and it was through my volunteer to say, hey, I'll give up my kidney to a stranger through paired donor exchange if there's a kidney out there that is a match for my husband, because I initially wasn't a match. I tried that, and so thanks to the paired exchange program, we were able to find a match where my kidney went to an anonymous recipient who needed it, and I was a match for, and there was a kidney for my husband. I have to say, as a nurse of 28 years and working and researching in chronic disease, the experience of being a patient as a donor was really eye-opening. And it was interesting because you have that knowledge as a healthcare provider, but you're looking at the system from a very different place. And what I found is some of the things that Christy was talking about, there's always more we can do, and the absolute necessity of paying attention to the needs of our patients, whether those are donors, whether those are caregivers, whether they're recipients themselves. It's just so powerful for healthcare, and we need to pay attention to that. So that's kind of why this, it was the nexus of my professional work with this very personal journey that I was walking. And so as a result, we ended up doing the paired exchange. I went to where my donor was, so I had to travel to Calgary and undergo surgery. My husband stayed in Edmonton, which is where we were living at the time, and underwent the transplant on the same day. And so you can imagine being a caregiver for someone that you're split across, and I could have had to go to anywhere in Canada to do that paired exchange, but thankfully it was several hours down the road, but still meant I couldn't be there with my husband. And how were we going to provide support for each other when we're undergoing this and not knowing what is going on for the other person was really an interesting experience, to say the least. But all that to say, everything's good. We're several years, and the kidney is functioning very well. Still ongoing medical appointments, and the handfuls of medication, as you shared, Christy, that's a reality. And the last picture that you see there, I'll just end, is that because this has been an ongoing family journey for many years, we're very involved with the Kidney Foundation of Canada, and I'm a longtime volunteer with the Lethbridge and Calgary chapters. And so what you see there is back in, I think, 2016, we did Kidney March in Calgary, Alberta, and it was a great experience to be a part of that, and just raising awareness around Kidney Foundation and organ donation. So there you have it. That's my story. So as a result, several years ago, we had the opportunity, through my volunteer work with the Kidney Foundation of Canada, was asked to be a part of the Organ Donation and Transplantation Collaborative. And that allowed us some funding to actually do a patient-focused research project that was entitled Improving Engagement and Empowering Patients on Their Transplant Journey. And so it was really just a wonderful opportunity to leverage my professional expertise in what I do as a nurse and a researcher with this very personal opportunity to elevate the lives, the voices and experience of patients and families and living donors. So we wanted to really look at how do we get at what really matters for those that are engaged in transplant journey. And really, as we were designing the research project, it was thinking about how do we purposefully engage those on transplant journeys every step of the way, from even the types of research questions we asked, to how we gathered information, to how we analyzed it. And so we really embraced the power of lived experience to really guide from the very beginning what this project was going to be. So it's really, we talk a lot about patient engaged research and patients who are partners in research. And this, I'm very proud to say, I think was a very extreme example of having patients engaged and walking that journey all the way along. Next slide.
So you're exactly right, Sandra. And that's what is so, I'd say, amazing and also wonderful about this project is that it really is a project that has been patient initiated and patient led. It is for patients, families, and donors by patients, families, and donors. And Sandra, as you alluded to, we have really embraced this. And right from the very beginning, right at the project initiation stage, where we looked to our patient, family, donor partners to really affirm the importance of the research question, as well as to evaluate those project goals, priorities, and outcome measures. And when it came to networking, our patient family donor partners were central to this process because we really worked with them to leverage their informal and their formal networks. So we were able to make connections to that larger PFD community. And this helped to ensure that we had diversity in perspectives from across our country, from across organ groups, from across cultures. And that was really important to this project, and it really helped set the stage for all that was to come when it came to our questionnaire as well as our focus group. And related to our resource inventory, which I know is going to be touched on a little bit later in this project, we really looked to our PFD partners for their expertise and their insight on helping us compile resources, tools, as well as their knowledge on what was available out there in the community through organizations that would be useful and relevant to other PFDs. And then when it came to our online survey, we really looked to them to help develop, to refine, and to participate in the usability testing of those survey questions to really help ensure they were understandable and that they were capturing what it was we were intending to capture. And when it came to our focus groups, and again, all of this is going to be explored a little more later in the project, we really looked to our PFD partners to help us co-create and design these questions. And we also had some of our PFD partners serve as co-moderators in these groups. And for our final report, we sought their guidance and their feedback on the content, particularly as it related to those final recommendations. And of course, for the knowledge translation, our PFD partners were instrumental in helping us develop a strategy to reach a broader audience. So not just the typical, more academic targets, but really those patient-facing organizations, and of course, our broader PFD community. Next slide, please.
So the goals of the project were kind of threefold. Essentially, we set out to improve access to the products and services that are available to patients, donors, and caregivers, to empower people on a transplant journey to navigate the system and advocate for themselves throughout the journey. And then ultimately, as Christy just mentioned, to develop some patient-led recommendations for renewing and improving the transplant system from the perspective of people who have lived experience. Next slide, please. So as Christy mentioned, there were 3 ways we gathered information to inform the recommendations, and we worked with our patient partners every step of the way. So the first is that we put together an inventory of resources. Next, we built an online survey. And then finally, we hosted a series of focus groups. So I'm just going to tell you a little bit about each one of those. Next slide, please. So our stakeholder network and patients themselves helped us to develop a really large inventory of resources that are available to patients and families across Canada. In the end, we gathered over 300 resources. And they include everything from program information through national organizations like the Kidney Foundation and the Liver Foundation and Canadian Blood Services, to resources from individual provinces and territories, to educational material from transplant programs and really from patients themselves, as you can see here on the screen. So the topics run the gamut, really, from financial support, medications, disease-specific information, post-transplant exercise programs, mental health, vaccines, and much more. And then throughout the project, we've been sharing those resources with people who are in need of help navigating the system. And so we've been sharing those directly with them. Next slide, please. So next we set out to learn about organ donation and transplantation from the perspective of people with lived experience through our online survey. That survey was open to anybody on a transplant journey, as well as their care partners and living donors as well. So our patient partners were absolutely instrumental in putting together this survey, in developing and pilot testing the questions that were ultimately used. And those questions included general questions on the transplant journey, questions around products, services, and supports that are available to people, navigating the system. So questions around how patients and families and donors are navigating the system as it is today. Some questions specifically on living donation, and then also a few questions on COVID-19 and its effects on the transplant journey. So the survey was made available in 5 languages, and ultimately we had 994 people across Canada share their transplant experiences with us through this online survey. Next slide, please. So finally, we also held a series of focus groups. So there were 4 groups in all, and then for a total of 20 participants. And we met virtually twice last year, once in the spring and then again in the fall. So the first online focus group included questions that delved further into the lived experiences that we asked about in the survey. And then the second focused on some of the themes and opportunities that arose during that first round of focus groups. Once again, we worked with patients, families, and donors to develop the focus group questions, which would help us to understand the lived experiences of people on a transplant journey. We were very fortunate to have focus group participants from across Canada and also across organ groups as well. Now, what did we hear through the survey and focus groups? So this is where we'll talk a little bit about the recommendations. Ultimately, there were 3 patient-led recommendations that came from what we learned. Next slide, please. So the first of these recommendations is to prioritize mental health awareness and support, with really the goal of reducing the stigma around mental health, increasing transparency, and normalizing the conversation really around mental health support. So what we found was that there are 3 ways we can do this, and we've included a few quotes actually from the people who participated as examples of what we heard. With regard to professional support, one person said that they wanted more access to mental health services before and after transplant. There's so little help, and what there is costs too much for those of us who are on or have been on disability because of our illness. Help is completely inaccessible for many of us. So that was very moving, and therefore it's important to integrate meaningful professional support at specific points along the transplant journey, and also throughout as needed. The second sort of sub-recommendation was around resources for healthcare providers. And we had somebody say that they felt that the whole journey was rougher on the people around them than it was on them. And we can begin to address this by making sure that healthcare providers have the tools that they need and the quality development indicators to support patients. And then finally, peer support. So one person indicated to us that that was very important to them, and thinking about going through a transplant journey or even starting to work up towards a transplant. It's scary for everybody, but it's completely normal. And so this recommendation is around establishing peer support groups linked to transplant programs for all organ groups. So now with that, I'll pass the mic to Christy to discuss the second broad recommendation. Next slide, please.
Thanks, Carrie. So our second recommendation is to expand resources and services to ensure more equitable care for those on a transplant journey. And more specifically, what this looks like is to reduce the financial burden for patients and caregivers, to establish and or support an existing central repository, which is really just a database of Canadian education and resources for transplant patients and those all on the transplant journey, as well as to expand and increase navigational support for these individuals. And finally, to support patient advocacy for all of these individuals. And as Carrie mentioned, there are some quotes that we heard that really bring home, I think, these key points. And the first one is related to that financial burden. I had to do fundraising to stay close to the hospital for 3 months post-transplant. I also owned a home and I had a family that I had to maintain. The financial obligations are astronomical, and I had to declare bankruptcy not long after my transplant. And that one always gets me because it is so relatable. And then we have related to the educational resources. I felt that a checklist that they had to, I felt that was a checklist that they had to do. Send in someone, talk to me about food. Hey, this is a brochure. Just read it when you get home. But I really didn't get it. Serious information about it, and I think it was just done way too soon. And finally, related to navigational and self-advocacy support. What I'm really worried about is people, what I'm really worried about is people who can't, who just don't have the skills or are so sick that they can't advocate for themselves. Next slide, please.
All right, and the third large area of recommendation is really around the improving coordination and the continuity of care. And it's no surprise that the theme that came up over and over again in that is the communication and the potential gaps in communication that cause, sometimes a lack of information or lack of clarity, and of course, increase anxiety and stress related to that. So there's just a couple of quotes here that really illuminate that. So in the process of being listed and delisted, I just felt a lot of information was not being channeled to me appropriately or in an updated manner. So that on again, off again, where are you on the transplant list? What are the updates? And just that not knowing and how the communication flows to patients and potential donors. And the other quote there, actually not having a person to talk to if you had a question, post-transplant about healing. And, that the idea that when it was pre-transplant, there seems to be more information. And then post-transplant, all those resources and connections that you had before were not there. And then what? And so there was just this lack of clarity and communication around support. Next slide.
Oh, it's me. It's sorry, Ariane. So on to our knowledge translation. And again, keeping in line with the essence of this project, we worked very closely with our patient, family, and donor partners. And our project team identified 3 main groups that we really wanted to ensure our project findings were shared with. And this, of course, included our patients, families, and donors, governments and organ donation organizations, as well as our research community. Next slide, please. And so when it came to our patients, families, and donors, we really recognized that we needed to meet them where they were at. And so one of the ways we did this was by ensuring that our project website, which had been up and running through the duration of our project, that it may be maintained and that it stay operational. And so that is still in existence, and we frequently update it whenever new material or tools are available. And one of those tools that we have produced was a short project summary that you can see on the right here. And that was, again, designed to really capture those key elements of the project that would be of interest to other patient, family, and donors without having to read the very lengthy and in-depth project report. And so to that end, that was also shared with all of our, or the individuals who participated in the surveys or the focus groups who indicated wanting to know more about the final results. And all of this has also is made available to anybody who is interested. And of course, we also offer these sorts of presentations and workshops and webinars, just like we're doing right now, that really are geared more at our patients and families and donors and less of that academic community. Next slide, please.
So next, how do we make sure that the voices of the people who participated, the transplant patients, the living donors, and the caregivers, are actually heard by the healthcare system, by those individuals who make big decisions around patient care? So the final project report was something that we put together and shared in English and French. That's actually available on the website as well. And we also put together a brief stakeholders report to kind of distill the recommendations and help governments, organ donation organizations, and transplant programs to identify how they can also participate in improving the transplant journey. We've presented the results of the study to the Organ Donation and Transplantation Collaborative, and also to federal, provincial, and territorial government representatives. So now Sandra will talk a little bit about how we've been sharing what we learned in the research community. Next slide, please.
Great. So absolutely, you know, there's all audiences are important, and one of those audiences is that we wanted to really be able to have conversation with is those that are formal care providers, nurses, physicians, social workers, all of the transdisciplinary teams that work in transplantation, to really highlight for them and underscore the voice of patients and recommendations for systems change. And so we have been able to present at numerous conferences for audiences that work in transplantation. And we actually have several peer-reviewed journal articles that are in submission to go to those formal medical and healthcare journals. It's been a really interesting journey because we've had the opportunity to submit to some very high impact journals that are about, you know, kidney care or transplantation, that tend to be very biomedical model. And the feedback that, you know, we've gotten some rejections, as always happens with academic journals, but it just has solidified the importance to raise this kind of research and engaging patients in the recommendations that have been generated. And we still have a lot of work to do in terms of having healthcare providers acknowledge and really understand the importance of this kind of research and the recommendations that are coming from those that they seek to serve. And so we're still trying to crack that ceiling, as it were, to really get into some very kind of medical journals with this kind of a very patient-centric research, because that's the audience that ultimately, you know, in day-to-day work need to understand and make space for and honor the journeys that their patients are on. So we continue to do that, and a lot of advocacy going on there. And hopefully we'll have at least two or three peer-reviewed journal articles that represent various facets of the program. Next slide.
And we are nothing if not determined, our project team. So I know we will get there. But that being said, I think one of the most important things that we really have learned from this project was that it is so important to really understand the lived experiences of our patients, families, and donors, because that is central to really creating and to supporting an organ donation and transplant system in this country that is truly responsive to the diverse needs of those that is intending to serve. And in order to do that, we need to really take the time on an ongoing basis to ask, to listen, and to learn from these individuals. Because after all, it is this lived experience that is so invaluable and it truly is priceless. Next slide, please.
So first and foremost, we'd like to thank and recognize the patients, families, and living donors who shared their experiences with us so generously throughout the project. We value and appreciate the contributions of every single patient partner, survey respondent, and focus group participant that we were lucky to have. The project itself was funded by Health Canada and led by the Kidney Foundation of Canada with research expertise from the University of Calgary, from Dr. Sandra Davidson and her team, and support from the Canadian Transplant Association and the Canadian Donation and Transplantation Research Program as well. Next slide.
And now that Carrie, of course, has thanked our sponsors and everyone involved, I want to just take a moment and thank all of you who are joining us today, who have taken this time to be with us and who've allowed us to really bring forward these findings and to share with us or to share with you this important work that means so much to us. I think it's important that more individuals out there in the community learn about this work. So I do thank you for being with us today. Next slide, please.
Well, thank you to our wonderful panelists for presenting the findings of that study. It has been really an amazing effort over 3 years of lots of hard work, but great reward with working with the patients so closely. Just before we begin our discussion, this is just a reminder to submit your questions for the presenters by typing them into the Q&A panel found in the Zoom toolbar at the bottom of the meeting window. And please avoid using the chat box to submit your questions. It just helps us to monitor them more effectively when they're submitted in the question pane. And also please note we are unable to provide medical advice for specific issues. So Sandra, I'm going to start with the question to you. Why is it so important to have patient engagement and patient-driven projects such as the My Transplant Experience project, particularly in research for improving patient care?
Absolutely. And it's essential. And it's interesting because I've seen a shift, even in the last 5 years in research, and even, when researchers put forward proposals for funding for research, a lot of the main funding agencies are now requesting that there is a collaborative process and that patients are engaged in the research in meaningful ways and not just kind of in this tokenistic sort of way, and really our partners along the way. So there is this movement. So it's something that has been needed for a very long time, but it's nice that we're having, like I said, large funding bodies like Health Canada and Tri-Council funding that is actually mandating that there's patient involvement at various levels to really inform that the types of research questions that are being asked are going to have an impact on the lives and the quality of the experiences and the quality of the treatment for patients and caregivers. So it's a nice movement, but we have lots of ground to make up. I think there's still a kind of a lack of, or there's those that are further ahead and those that are kind of lagging behind in their understanding of how to really meaningfully engage patients and caregivers and those with lived experience into their research. So there's a lot more training that we're starting to see coming of researchers to do this in the right sorts of way, and not have it feel that patients are just kind of that we're consulting patients, but it's just kind of an add-on, which never if it feels disingenuous, we're probably not doing it justice. And really, I think it's just so powerful for advocacy, for policy, and for decision makers to really truly understand not just the kind of more academic or scientific outcomes, but the impact and the influence that can have on patients' lives and well-being. And I think a perfect example is how clearly and consistently we heard the mental health challenges and the needs, and that's really an area that we can develop and grow and increase and increase the quality of life for patients and caregivers on transplant journeys. And nothing, and again, Christy, like you said, that lived experience is priceless, and it's more meaningful, impactful than any statistical number that we could come up with. And so it's really this wonderful marriage of having that really high quality research with the components of lived experience to kind of validate it and bring it to life. That really means, I think, that we can get the attention of those that are seeking to transform the system in a very compelling way.
Yeah, totally agree with you, Sandra. I think we learned so much and we gained so much information from the people who are living this at day to day. And really it was such strong patient stories and such strong feedback that we received throughout the project that really did lead to those recommendations, and we just kept hearing that voice. But now we know the importance, and there are so many factors as to why this kind of research is important. Christy, I'm going to turn to you and ask, how can we make it easier, or how can we encourage more patients to take part in sharing their lived experience in order to change things like policy and to improve, healthcare in general?
Yeah. Thanks, Lydia. I think that's a really good question. It's a really important one to ask. I think in large part, it's really about meeting those patients, families, and donors where they are at, and recognizing and addressing many of the barriers that can often prevent diversity and perspective, can often prevent people from feeling comfortable to really open up and to share their story. It's about recognizing that can be a vulnerable experience. It can be one that is traumatizing and triggering, but those are the voices that we really also need to hear from. So recognizing that there needs to be more done to address those potential barriers, even simple logistics a lot of times. So recognizing that sometimes, that PFDs, we have lives too, right? We have jobs, we have families, we have a lot of obligations. So taking steps to really ensure it is feasible and accessible for these individuals to come forward, to share their stories, to bring their voice to the table. And so even, of course, it comes down to that remuneration and that reimbursement, recognizing that financial constraints can be an issue and how can that be addressed and rectified. But I also think there's a huge onus on organizations, and because they're the ones that really need to embrace this and really value and respect what that means. And they need to embody it. They can't just sort of talk the talk, they need to walk the walk. So that really involves, I think, embracing it in their overall mandate as an organization and taking steps to address that. So even whether that's ensuring greater cultural sensitivity or adopting equity and diversity and inclusion to their overall sort of mandate, that all makes it more accessible and I think possible for these diverse lived experiences and perspectives to come out and to be heard. So, I mean, there's a lot of other ways, but I think those are some of the main ones for me.
Thank you, Christy. I've had a question in the Q&A pane very similar to that as well come through. How do they get involved and how can they share their advocacy story with advocacy groups? And I think really it might also be a case of reaching out to advocacy groups directly, reaching out through your transplant unit as well. There's a way of sharing that voice, and there are many different vehicles for sharing your story, but I would recommend in that first stage is just really get in touch with your advocacy group or patient organisations that can certainly help your story as well. I have a question for Carrie, actually. As project manager, you pulled this big project together and had reached out to quite a number of people, be it organ donor organisations, to government representatives, other patient groups, other people, researchers in general. Did you want to just share your experience of how you went about reaching out to everybody and how people felt about being part of this project?
Absolutely. So we were very fortunate, as we've mentioned before, to have patient partners be a part of every part of this project. And that includes reaching out to all of these organizations. So really, it was kind of a grassroots beginning. We started there with patients, families, and donors, and then went out after, like, from there. And so really, we asked our patient partners to share their professional and personal networks so that we could reach as many people as possible. And it was an incredibly moving experience to start to make those connections, both with patients and with some of these organizations. And there was great enthusiasm, we were very happy to see, on the part of the people who joined our stakeholder network, who joined our patient sort of partner networks. Like, there was quite a bit of enthusiasm. It was very, very rewarding to have so many people want to be a part of this project and really want to make sure that patient voices were heard.
Oh, you're muted, Lydia.
Thanks, of course I am. When we started this project more than 3 years ago, and we were talking about it in a group, we had the luxury of being face-to-face in a meeting room all together. As we're about to embark on setting up the survey and getting it out there to the public, of course, we had the pandemic hit and we all went into lockdown. And so not only did COVID affect society as a whole, or us in general, it really did affect the transplant community quite greatly. So I just really wanted to zone in on what we heard from that project for people who were either on the transplant waiting list or transplant journey throughout COVID. So I'll open the floor to our three panelists if they'd like to talk to that piece as well.
The thing that comes to mind for me, it was really, there were a couple of interesting twists, and I think this is not unique to the folks that are on a transplant journey, but healthcare in general, that all of a sudden there was this access to telephone appointments and Zoom appointments that before we would have, especially you think about folks that are in rural areas traveling 2 and 3 and 5 hours for a specialist appointment or a transplant workup visit. And all of a sudden the health system responds because of COVID and makes appointments with specialists and healthcare providers in general more accessible. And so folks that have issues with mobility or immunocompromised issues aren't having to feel like they're risking to go to a hospital to have a visit. So there was that side of it, but then there was also the side of this, isolation and lack of those community supports or the social supports that people really relied on, and the toll that took on their mental health and their well-being. Not to mention folks that had issues with their income and their employment were affected by COVID and some pieces there. So it was really this, there was so many facets to it, but I think the thing that stands out is, that access to care and the ability to do that with technology. It's going to be interesting to see now what happens, that we're in a different phase of COVID. It's not going away, but how is the healthcare system going to take that up? We now know that it works, and it creates access in all kinds of ways. And so how do we continue advocating for the use of those things where it's appropriate and where it makes sense, but to provide that access and reduce the burden in so many ways? I guess having said that, though, it also illuminates that there are those folks that have access to good technology, good access to internet connection, and those that don't. And so that's creating a different barrier that we didn't see before. So the journey continues, but that's kind of what stands out for me about what we learned.
Christy, did you want to comment?
Sure.
Carrie?
Yeah. I would just add to that. That was, I think, a really important, insight that we heard. A lot of implications for our healthcare system, but I think the other one, in addition to, of course, how distressing and I think anxiety provoking this whole entire experience was for our patients, families, and donors, was also how at times siloed our entire organ donation transplant system can be in this country. And that really came through when it related to the sharing of information. We were hearing from a lot of our participants that they struggled to know where to go, who to go to access the most current and the most correct information. And that often they were going to their own transplant teams, or they were looking to the organ donation organizations, and it wasn't always readily accessible. And what one person, of course, was hearing in one part of the country to another was very different. And of course, that does reflect how I think decentralized our healthcare system is in general. But this was where it really was a struggle for our patients, families, and donors. And it was very reflective of a lot of the challenges that they encounter, outside of a pandemic with trying to navigate transplant. So you can appreciate just having that basic being on a transplant journey, and then have that added piece related to the pandemic and trying to figure out what you need to do in order to protect yourself, where you need to go, and what it is you need to be able to access. So I think that was a really illuminating piece that came forward as well. Carrie, do you have anything you wanted to add to that?
Yeah, I really can't add anything equivalent to what you and Sandra have already said, I think. But what I would say is one of the things that we heard is in terms of access, it was wonderful to have the opportunity to reach out to healthcare providers and not have to travel such long distances to get treatment. But we also heard from people that sometimes they prefer that face-to-face interaction. And so it's really about, as Christy and Sandra said throughout the presentation, it's about reaching out to patients and incorporating everything and meeting them where they are. So I think that was a really interesting point that was made during that set of COVID questions that we addressed.
Thank you.
Okay,
sorry,
sorry, Lydia. I was just going to say, if you want to know more, there is a section, of course, in that final report related to COVID that really highlights those key findings from that element. So I do encourage you to visit the website that, of course, I think Lydia had already put in the chat for that final report. You don't have to read the entire report, but you can skim through for areas that are most relevant and meaningful to you. So I would encourage you to check that out.
Yeah, thank you. Good point there, Christy. I had a couple more questions come through on the chat box, and one of those was part of the transplant journey is the fear for rejection and also for the actual rejection itself. Were there any specific findings in that area that came through during the project?
As I'm thinking about it, where that came up is that very real ongoing fear of rejection. There was a theme around not knowing and instability and always living in that place of anything could change at any minute, and in a very big way. And so again, if you all of a sudden things are going along and then wow, you have an episode of rejection and having to deal with that. It was this theme of this sense of uncertainty that a lot of the examples that we heard were about, that fear of rejection. And I never know from one day to the next what's going to happen and how. And that's where I think the mental health piece really comes in, is that a lot of folks that are, on a wait list and they're day to day, do I need to drop everything and be at the hospital tomorrow because there's a deceased donor, or now I have an episode of rejection. It's how do we maintain and provide supports for mental health and resilience and having folks that are living in this uncertainty for years. If that's where it came up, I think is just that unique experience for folks in a transplant journey about the uncertainty. And certainly a piece of that is that fear of ongoing rejection.
And I would just add to that, Sandra, we were also hearing, I think, related to the need for peer support and for connection. And that's also where it sort of came up with coping with that unpredictability and knowing that sometimes the only people who can really understand and relate to you are those individuals who've been in those same shoes. And so that was really, I think, evident when we were hearing the need for that peer support and that connection. Again, to not burden a recipient's loved ones, was that need to really have those outlets where they could go to share their feelings, to share their worries and their fears. And again, I really I encourage you to look at that report, because all of this really we delve into it a lot more. This is very high level, but you'll see a lot of those themes. We also had 6 themes, and you'll see that a lot of this relates to what we're talking about today and what your questions are.
And I would just add that, as Sandra and Christy have alluded to, that these themes and opportunities for change are all interlaced. Really, they all kind of work together. And one of the themes that came up was around support for caregivers. So that's an area where quite a few of our respondents said, our caregivers need support too. The people who are supporting us really need to have formal and informal supports in place. So those peer support programs for them as well, professional support for them as well. And that helped patients who are on a transplant journey to navigate that uncertainty.
Thank you very much. We've also had a question about have there been any developments from government agencies regarding the findings, and have there been any changes to any mental health and financial supports for the group, and what are the next steps? While I can't really speak to government on this particular piece, I know that from that mental health and peer support perspective, certainly we've been looking at how we can expand our peer support findings as a foundation. And I know that there are some virtual groups that are kidney transplant specific at the moment, of transplant specific groups. So there is still, there is that expansion of the peer support. So it's very targeted to one specific area, which is the transplant population. So anybody who has been affected by transplant along the journey, we certainly can support them through our peer support, and are very welcome to come along and join our peer support group. So that's one thing I can add there, but I'll ask Carrie, Christy or Sandra if they'd like to also weigh in on that question.
That is a very lofty question and a very lofty goal we're currently working on. So I would say at this point, we're still working on socializing these findings and really championing what we discovered, and working to, I think, increase awareness and uptake of these findings. So that being said, I would say that we do have, as part of that, the larger collaborative, which we didn't touch on, but it does bring together key stakeholders from across our country related to that are involved in our organ donation transplant system. We have presented to them many times, and they are very aware of this. And I think it's about having key individuals who are not going to let this go and who are continuing to champion this, whether it be key individuals or organizations, and continuing to pursue this work. And I know that is definitely the case. We're not dropping it as a project team. I know the Kidney Foundation is continuing to championing this important work. And I think as things evolve, there will be opportunities, I hope, where many of these recommendations are going to be given, I think, further consideration as it relates to perhaps policy creation and development. But at this point, no, nothing has actively necessarily been taken up or addressed.
Thank you so much, Christy. Sandra?
I was just going to add that, I'm reflecting on, we've, like I said, we've presented the findings at numerous scientific and healthcare conferences, and one that comes to mind is the poster presentation that we did at the Canadian Society of Nephrology, and places like that where healthcare providers are, and having the ability to share these findings with frontline healthcare providers. And in my mind, I'm thinking about some conversations I've had with nursing colleagues and nurses that work in nephrology and transplantation and dialysis. And the thing that it's been really refreshing is a number of them had said, yeah, a lot of the findings and a lot of the narratives that are in the report or that you're highlighting in this presentation really hit home. My patients that I care for are saying these things. And so now there's this piece of research and this piece of advocacy that those individual clinicians that are poised to make changes in their programs at local levels, whether that's in Alberta or New Brunswick or wherever it happens to be, we're providing them with the evidence and the kind of the research to kind of go to their program teams and say, hey, we need to be doing a better job with this. Let's talk about it. So at all kinds of levels, I think there's a big policy, big P policy across the country, but there's also these opportunities for local systems change that if we can get this information into the hands of those that are already wanting and acknowledging to make change, it gives them another tool. It gives them more ammunition to go ahead and do those things. So there's the little everyday level of things that can change, as well as the bigger pieces that we need to keep pushing on.
We also put together a little bit of a roadmap for those organizations, right from local right on through to the federal government, just to help each of the organizations see where they fit into applying this from a policy perspective or making a difference to people on a transplant journey. So that's actually posted on the website as well. But yeah, it's a very specific kind of list of recommendations based on the main recommendations and suggestions on ways that everybody can get involved.
Thank you very much. And I'm just circling back to, there were some questions in the chat earlier, and they were a little bit more directed and specific about accessing finances and accessing medications for transplant. So while this is probably beyond the scope of this actual discussion, what I'm going to do is actually put some resources in where you can actually reach out to find out more information as well, and be supported with those questions through the Kidney Foundation initially, or we can refer you to the right people that could help you with as well. And I guess, are there any final comments you would like to make? Is there anything that you would like to share, or something that you learned personally that you think would be worth sharing with our audience here today?
I'm happy to go first. I guess for me, what really resonated was people's generosity in sharing their experiences, and the fact that each person's, while there are a lot of commonalities, each person's journey is very unique to them. So I found it to be incredibly moving to have the opportunity to really have those conversations with people on a transplant journey directly. I think the report is absolutely representative of what we heard. And I think we specifically made an effort as well to make sure that those voices were literally heard throughout the report and throughout all of the work that we've done. So there are actually quotes from people on a transplant journey in everything that we've done. So for me, it's been an honor to be a part of it.
Yeah, I think I would have to echo that too, Carrie. I really felt honoured and humbled to be part of this particular project as well myself. Christy?
I would just add, I think how important and impactful it is when we give our patients, families, and donors a voice. And when we empower them to really share their needs, their stories, and their concerns. And that's not done enough. Not really carving out that space for this to be done. And it needs to be done more so. I know a lot of times, especially in our healthcare, we're moving more towards patient-centered care, but what does that really mean? And are we really taking the time to hear from these individuals in a way that matters to them? And what are we doing with that? So I think it was just so important. This is one of the few projects that I haven't been involved in many projects like this at all, where we truly gave these individuals the space to come forward, and we didn't have any preconceived notions or ideas, and we wanted to hear from them. And I think what we've produced here really speaks to that, and it's something that I'm very proud of. But I'm also just very grateful to everyone throughout this process, because we couldn't have done it without that trust that so many of our patients, families, and donors placed in us to really do right by their sharing. And so I'm grateful to everyone who's been involved.
Thank you so much, Christy. Truly, the patients have spoken, and we've heard them very loudly and clearly, and it has been wonderful to have so many voices make such a loud noise about their experience. And finally, Sandra, I'll turn it to you.
Yeah, a couple of things come to mind. Again, it's very humbling to be a part of this, as others have said, and to want to do right and treat these stories with the reverence that and the impact that they so deserve, and shepherding that forward in a way that honors the trust that people have placed in us in sharing their journeys. And the other thing that I'm cognizant of is really having meaningful engagement with people with lived experience, and not that kind of lip service or tokenistic sort of thing, and the sense of empowerment and agency that can come from being really engaged in something that you can see, wow, by me sharing this story, I'm contributing to a movement, to making a difference. And I think from, with my lived experience hat on, not my researcher hat on, it creates another opportunity for engagement and purposeful action towards changing the system, right? For ourselves as people with lived experience, but also for others that we see around us that are on that same journey. So there's this great sense of empowerment, and there's something we can all do. And if it's as simple as sharing our story and signing up to take a survey, it makes a difference. So that's an important piece. And I would say, from the researcher hat, with the researcher hat on, we can do this kind of research very well and honor the stories if we get out of our own way. And what I mean by that is, there's kind of taken for granted ways that research happens. And we had to constantly throughout the system kind of say, well, wait a minute. Are we just doing this because that's the way that, we think research needs to be done? And if we want to honor, patient engaged research, we might have to go back and change ethics 5 times because our patient advisors have said, no, we don't like that question, and it really needs to be more focused on this. Or we want to, change how we're allowing people to engage. Maybe not everybody can come to a focus group. Maybe they want to be able to answer the same questions when they have the energy, when they have the time, and send it in a Word document instead of showing up to a focus group. And we had to adapt to that and listen to that and honor that. And we did. And so it can be done, but there's that purposeful commitment to really engaging beyond just kind of lip service. So I'm very passionate about it, as you can tell.
Yeah, we certainly feel your passion, and it's wonderful that you're here today to share that with us. Look, thank you again to our wonderful panelists. It's been just such a pleasure to work with my colleagues and friends on this particular project, and even a bigger thank you to our patients, our caregivers, and our living donors that were part of this project, who shared their voice with us, and who really just made such a difference and made it such a wonderful project to work on. So thank you for that. And just before we go, I just wanted to say there have been a few questions throughout the chat box, and I'm sure other people might want to connect. So we invite you to contact us if you have any further questions, or to speak to someone in your community, or to access further educational materials and resources. Those details are up on the screen now, so please do not hesitate to reach out. We are here for you. Over to you, Janice.
So thank you, everyone, for attending this webinar, My Transplant Experience.